Hi everyone, my name is Carmen Beaumont. I'm the Principal Psychologist and Director of Vita Psychology. As you know, I've been doing a series of different videos inviting different professionals to talk about the areas of expertise. And today I have invited Rita McMarrow, who is a local GP. And I'll let you, Rita, introduce yourself in a minute, because one of the things that it came to my attention, Rita, was that people were not making appointments to see their GPs. And immediately there were alarm bells going off for me. So I thought I'd invite you to talk to you about the importance of ensuring that you continue seeing your GP regardless of, and especially through COVID. So would you like to introduce yourself, Rita?
Yeah. So thanks a million, Carmen, for inviting me to have a chat with you today. So as Carmen said, my name is Rita McMarrow and I'm a GP at Parkville Medical Centre. And in addition to my clinical work, I'm also a primary care researcher at the Department of General Practice at the University of Melbourne.
Yes, so you're up to date with the latest research.
Well, yeah, I try to be, absolutely, yeah.
So what are you finding, Rita, as a GP that's happening? What sort of trends are you finding in terms of general care and people keeping appointments?
Yeah, so I guess, we're really kind of going through this COVID crisis, I guess, together. And we have found that in general practice that there has been a reduction in the amount of people who are attending for management of their chronic conditions, particularly. So that's people who may have conditions such as diabetes or heart failure or chronic lung problems. A reduction in those people coming in to see their GP for regular care.
Okay.
Yeah.
So what would be some of the concerns from a medical point of view, Rita, for these patients, for these people who are not continuing with that care?
Yeah, so people who have these type of conditions generally would see their GP on a somewhat regular basis, and that's to make sure that we are keeping all of the different things under control, that we're checking in to see that how they're going with their medications, with their current treatment. And the thing that's worrying GPs and experts is that if people are not attending for care now, given that we know that this pandemic is going to continue into the future, that the downstream consequences of not attending for care now is what is really concerning GPs.
Yes, so then people are likely to then experience even longer term impact. It's likely to impact their health more from a longer point of view, longer term, Yeah,
exactly. So that if, for example, we have found that there's been a big reduction in people who are getting their kind of tests for diabetes, so the HbA1c. So there's been a reduction in the amount of people who are getting that routine test done, or people getting their cholesterol checked, which we all, we know are risk factors for developing complications in the future. And so, pathology companies have reported that those have been decreased by somewhat, 30 to 50%. So that's a large number of people
that's huge.
who are not having those routine tests done.
And I would think that especially through COVID, it will be much more important for people with chronic conditions to make sure that they are on top of them and that those conditions are being monitored and regularly checked.
Yeah, absolutely. And I think if we consider as well, that even though, the kind of restrictions are starting to lift, there's this, this kind of period of time of the COVID pandemic is going to continue. So seeing your regular GP now and going forward is really important. Yeah, absolutely.
What would you say to people who are hesitant to go to GP clinics, what would be the options for
Mm.
ensuring that they continue with the care that they very much need, not only for the regular health, but also, as you mentioned, through COVID, they are at risk also, increases the risk, so that regular monitoring check is important. So what would you say to those people who are hesitant? What would be, do you say, for example, of telehealth?
Yeah, so I think people being hesitant, I can understand. That because we have been given the advice that we should restrict the time we spend outside the home. But all the way through this pandemic, one of the 4 reasons initially, and now 5 reasons, that to leave the home was attending medical appointments. So the fact that was, there was only 4 things, and that was one of the things that the government explicitly stated should provide reassurance for people that it is safe to attend medical appointments, not only with your GP, but with other providers, potentially specialists or psychologists, the nurse educators you might see, physiotherapists. They're all still medical appointments. And luckily, earlier on this year, we have been able to start providing telehealth for people as well. So most GP clinics are now offering telehealth appointments, as well as people may have heard the term face-to-face, which is not necessarily a term that we used a lot before, because all of our consults really were face-to-face, which means going into the clinic and seeing your GP in the clinic. So what's happening at the moment is that people can have a consultation with their GP, either over the phone or on, video conferencing, or face-to-face. So that's in the clinic. So what's happening is people are generally ringing up to make appointments, and at that time having a discussion with the receptionist whether they would rather a phone consultation, or if they would like to do video conferencing or a face-to-face appointment. And the case may be that, we will have a telephone consult, and then I may ask someone to come in and see me if I feel they need, a physical examination or to have further testing arranged. So it's actually easier now than ever to see your GP, well, maybe not to see them, but to talk to them and to discuss some of the, the concerns that you may be having about your health or your well-being, or even what's going on with the pandemic. And this telehealth situation is really making it easier for people to come and see us in clinic.
Yeah, and that's great to know that you're there's different ways of accessing that very much needed service. And as you said, people will call initially if they have any hesitations of attending face-to-face.
Yeah.
And then you, as the expert, and after you've asked some questions, then you can decide whether or not then you move that appointment to face-to-face, which is great. So there's that reassurance that they will get your initial input and then determine if, if there's anything needed beyond that.
Absolutely. And I think the other thing to be aware of is that general practice has changed a little bit in terms of when you do call up to make an appointment. Our receptionists, all of the receptionists across Australia are doing really Trojan work, asking people questions that they normally wouldn't ask you when you call up. So that may be asking you if you have symptoms of COVID-19, because it's very important that if you do have those symptoms, that we know about it in advance so that we can put the necessary precautions in place to protect you, protect the workers, and protect the staff at the clinic. And the other thing as well is you may have seen, pictures of what's happening outside the front of clinics. Most clinics are also asking you those questions out the front of the clinic. So when you speak to the receptionist, they will let you know the procedure to follow. So it is different from before. You could, you know, just walk into the GP clinic, whereas now we're asking people these same questions again before they enter the clinic, and also checking people's temperatures, because we know that fever is a common symptom of COVID-19. And I think it's good to be aware of these things and understand that we're doing this with everyone who presents. Even when I you know, go to work in the morning, the receptionists are asking me if I've had any symptoms and checking my temperature as well. So it's something that's happening to everyone, and we're not just singling people out and asking certain people questions, if that makes sense.
Yeah, and I dropped by your clinic actually a couple of weeks ago, and I wasn't able to just go in. So it was reassuring from that point of view that not just anyone could go in. And people were taking turns in attending that clinic, which was great. So once again, you know, it's important for people to know, and obviously you are a medical clinic, so you would have this information firsthand anyway in terms of safety. But I think for people to know that you're taking every precaution to ensure that everyone who comes in contact with all of you, but also at the clinic, is safe. So there's really no reason for people not keeping their appointments or making appointments.
Yeah, I mean, absolutely. And I think that now, you know, it is really important, if you are having symptoms that are, you know, normally concerning, and that you would usually, you know, say, oh, I best book in to see the GP to have a chat about that. You know, now it is really important to make sure that you are continuing to do that, to see your GP about any symptoms or that may be concerning to you, to make sure that we can appropriately investigate and manage those symptoms.
Yep, right. Well, thank you for that, Rita. I hope that people who were hesitant about making an appointment to see their GP will think twice about how important it is to ensure that those appointments are kept and made, especially people with chronic conditions. But I think all of us, is important to make sure that we look after our general health. So great.
Absolutely.
Thank you so much, Rita.
No worries.